Kevin wrote 3 things on the paper that I distinctly remember. The first thing he said was, please tell me what you're going to do to me before you do it. He was asking for anticipation. He wanted a plan. Kevin wanted to be on a journey, not in little pieces. The second thing he said was this. He said, I got 10 doctors and 20 nurses and 30 tests. He said, you're all wonderful. Could you please talk with each other? That's what he wrote on the paper. Please talk with each other. He wanted us to be a team. It was too complex, the journey he was on, for this to be done in pieces. And the third thing he said was, I've been in the hospital 30 times. I actually know more about my illness than most of you do, and I certainly know more about my life than you do. He wrote on the paper, please ask me what I think. I kept that for a long time because I think he was telling us our job. He was saying, plan ahead, be a team, and put me in charge. Give me power. And to me, when I go back to ACOs or bundled payment or medical homes, and I try to understand what we're doing, I just keep thinking about that kid and people like him. That's what Area 3 is. That's creating journeys. Now, the law has given us this vocabulary thanks to leaders in the room, the Accountable Care Organization, one of several options: bundled payment, medical homes, health homes, Accountable Care Organization. What do we imagine here? I don't imagine the status quo repackaged. And I guess my biggest concern about ACOs might be that if we get it wrong, that's what will have happened. We'll have taken the status quo delivery system that doesn't serve Kevin well, today's Kevin's, and put it under a new name. And that won't be success. That isn't meeting the social need, not better care, better health, and lower cost through improvement. I'm viewing the Accountable Care Organization, I hope, as new care design, created, as Mark said, in a very unusual context, a context of open choice, fee-for-service payment, and the absence really of restrictions, which is a very bold idea and an important idea. And if we do that well, Kevin will be well served, and so will our current financial crisis in healthcare. If we do it poorly, it'll be the status quo renamed. The principles that would underlie this redesign are several. These are my own words. They're not in the law, and they're not necessarily what will emerge. But first, it will put the patient and the family at the center. It will honor preferences and values and backgrounds and resources and skills at the individual level, and will engage people in shared decisions about their diagnostic and therapeutic options. This will be centered around the patient, not around the care delivery. It will have a memory. Amnesia is a real problem in healthcare. When Kevin says, please talk to each other, he also means remember me. He means keep the data, information together. Teamwork will now become paramount in the ACO, I imagine. Patients won't have to repeat their stories. They won't have to tell people to talk to each other. That'll happen automatically because now the dynamics and the incentives are in place for people to be a team, which I think they want to be. The third is that handoffs will matter. That's related to that. Patients' journey through the system, and we hand them off, and it's the handoffs where things tend to go wrong. It's these boundary places. The concept of the ACO would be to create a seamlessness that is real for the people who need us not to drop the baton. Make a plan, said Kevin. Tell me what you're going to do before you do it to me. That involves crafting pathways together. It will have to respect resources, better care, better health, and lower cost through improvement. All three will matter, and we need agents, stewards in American healthcare who understand that resource management is healthcare also. And the focus there is not on withholding care, it's on reducing waste. And so becoming sensitive to the nature of waste, wasted time, wasted effort, wasted materials, wasted supply, wasted information, wasted ideas, wasted spirit, and making sure that every step adds value is good for Kevin and good for meeting the social need. And an ACO, to my mind, is a place cognizant of that. And then it will reinvest where investment counts. We now invest in volume and throughput. The ACO will invest in value and outcome, which means resources are moved to where they're needed.